right, hi guys, I'm Dr. Rachel Anderson. I come from the Animal Hospital at Bonita in Bonita Springs. Today I'm going to be talking about supporting your senior and special needs rabbits. Can everyone hear me okay, and does this work okay? All right, great. Let's get started. So first of all, a little bit about me with special needs rabbits, and kind of when I realized that that was an important topic was I had a rabbit come into the hospital that I was at, and they had developed a head tilt, which is a common thing for rabbits. Unfortunately, the owners of this rabbit were not able to administer any sort of medication or really help with that. And so I'm kind of known as a sucker, and I took it home, obviously. And oh boy, I was in for a challenge because these are all things that I had told people to do. I had told people critical care and fluids and penicillin and all this great stuff, but did I do that at home every day? No. And so it was difficult to do, but also very rewarding seeing him be able to get better. And then also that's kind of how I met Southwest Florida Rabbit Rescue. Was Jen was able to take him and bond him with another lovely head tilt rabbit, and they were a really great pair for a long while. So that's kind of when I started to realize what actually goes into the care of these animals. All right, so senior bunnies, first of all, I'd like to say a senior bunny, I kind of consider around the age of like 7 to 9. It's not like there's one age and all of a sudden this is the day that your rabbit turns into a senior. It has to do with like what breed it is, how its health is doing, all those sorts of things. But when they become a senior, then it's more likely that they can get these conditions. A senior or an older animal, that's not a disease in itself, but it makes it more likely that they can run into some of these challenges. So I've listed a couple here. They can have any sort of mobility impairment, dental disease, vision or hearing loss, GI issues, renal or kidney disease, pododermatitis, or not just uterine adenocarcinoma, but certain types of cancer. All of those things are going to be more likely when they get older. So some things that you can do. First of all, just tell yourself you can't do that much. They're a senior rabbit and they're going to develop some sort of health issue, most likely at some point. So don't beat yourself up. Don't stress out about the things that you can't change. The one exception to that is when it comes to uterine and testicular cancer. You should beat yourself up about that because you should be getting your rabbit spayed and neutered at an early age. Another thing that I tell people, they're like, oh, I'm so worried about the anesthesia. I'm so worried about the procedure. Okay, well, it's a lot better to do it when they're younger versus it's going to be a procedure that's actually a lot harder and a lot worse and harder on them, harder on the vet, harder on everybody if you're having to do it when they're older. So do that early. The other thing that you can do is just keeping up with your good husbandry. So Timothy hay, that's still the staple of their diet, even when they're a senior, even if they're a picky eater. I tell people who say that the rabbit is a picky eater, yes, you can try Orchard, but also try different brands, try doing it different ways. Try as best as you can not to give up on Timothy hay, because when you give up on the Timothy hay is when we really start to run into dental disease problems. If you were able to go to the lecture earlier today by Dr. Kitchen, it goes into dental issues, and trust me, it's stuff that it's better if you just can avoid the whole thing altogether. That is the ideal way to go. The other thing to do is that you want to have them on a soft surface. So you always want to have them on a soft surface, but something that I mentioned in the previous slide, pododermatitis, that's going to be much more common in your older rabbits or rabbits that have unequal weight distribution. So having them on some soft protective surface, that's going to help their little feet so much. And then some other possible adjustments depending on what's going on. So one is if they have any sort of vision impairment. This kind of comes from dogs and cats that I've learned is a lot of animals can do really well with vision impairment. Usually it's the person that's more upset about it than the animal is, but keeping things consistent. So if you keep everything in their environment, their furniture, everything as close to the same as possible, that can really help them, and they can learn other ways to navigate around that. One with mobility impairment is if you keep everything on the same level. No more trying to make them go up and down in any way, and that includes litter boxes. It seems so insignificant because that's the barrier to entry of a litter box, but for them, that's a big deal. So you can look on Amazon, there's a ton on there. Or if you want to just cut one out yourself, take a litter box and cut a little part for it. That helps them so much. And then another is if they're having chronic GI issues, having critical care on hand, knowing how to use it, what dose. And something that I tell people before you have a senior rabbit, when you don't have problems at all, if you can have critical care on hand and you can use it as a treat or like a good thing for your rabbit, just give them little syringes every once in a while, make it a positive thing. That way, when you run into these issues later, it can just be an easy thing that you have on hand and it doesn't have to be such a big deal. So this is a product that I use all the time and I really love, pH Notix. It helps in those older rabbits with mobility issues because when they have mobility issues, they're having a difficult time getting their back leg up to their ear up to clean it. So I see a lot of like waxy kind of crusty ears in older rabbits. This product, you take it, you can see the little nozzle right here. So you're going to take that on the top of the container, put it right here, base of the ear, just a couple drops, and then you'll just massage the base of the ear in that area. That helps loosen up wax so that they can clean it themselves. What you don't want to do, never, ever, ever try to clean it out yourself. So I might clean some of it out at the vet, but that's because I'm actually able to visualize it. I take a cone, there's magnification, I can see exactly what I'm doing, but please, please don't try this at home. No Q-tips, nothing like that, because it's really easy to actually puncture through there and cause a lot more damage. So another thing that you can do is at this time, unfortunately, they might need some grooming help down here. So you can give them baths. This is a question that I don't know where the myth came from that like you can't get them wet. You can. And luckily, most of the time, you're actually not having to get any of their top half wet, just the bottom area. So I find that it really helps if you have 2 people doing this process. And I would invest in like $2, like just a box of gloves. It's kind of yucky, so I would wear gloves. If you don't need to, you don't have to, but just a tip people forget about. Then you're going to use some lukewarm water. I typically just use a sink, and you'll generally wash the area with water, and then you can use Johnson & Johnson baby shampoo or Dawn dish soap are 2 that I really like, and you can just lather the like, you know, there's going to be like little fecal balls, things like that that have kind of crusted up in there. Get that stuff off. Other people prefer to like kind of groom it first before getting it wet. It really depends on your tolerance. One thing is to really watch out if you're grooming before, especially. I found that their skin can be so delicate, you can rip the skin. So you have to be very patient, very gentle. But a lot of those senior rabbits or any rabbit with a mobility impairment, they're going to need some extra help with the grooming. And the other really important thing to know is that you want to make sure that you get them as dry as possible after. You don't want this to lower their body temperature in any way. You don't want them to then get any like moldy stuff down there. So make sure that you keep them as dry as possible. And then keep things fun. You want to keep the enrichment going. This slide actually started as a typo of I put enrichment should not stop because they are odd and I meant to put old. And then I was like, actually that works. Odd and old. So you can do tons of fun things with these. So I'm sure you guys have visited the exhibit hall. It's super cool. There's tons of enrichment down there. And if you want to be a cheapo, which is fine, I'm like that a lot of the time, they love the stuff that you're just going to get rid of. So if you use some paper towel rolls, a bag, that rabbit that I took home, his favorite thing was the chip boxes. He didn't eat them. He didn't eat the chips, but just shredding the box. Like he was obsessed with that and could do it all day long. I would recommend looking on YouTube, TikTok, places like that. They have so many creative ideas. I think that's one of the places they're great for. Don't replace your vet with YouTube, but like creative, fun things to do, that's a great place for it. Another thing about enrichment, I went to an avian conference a couple years ago, and they did a study on parrots. I don't know if you've ever heard of Alex the parrot, but it was a really cool study. Look into that. The person that did that study now was studying African greys and basically their preferences for enrichment, because people often say, oh, my bird doesn't like to play with toys. Actually, they do. You're not giving them the right toys. So it's just like us. It's just like I was put into soccer as a kid. Not my vibe, not my thing at all. I went from covering like this to covering like this. That's how good I got at soccer. But there are other things that I enjoyed. So it's the same for them. Not every rabbit is going to like it just because they say, oh, this is a great rabbit toy. Well, they'll be like, no thanks. So try different things, keep it fun. Mental stimulation is so important for them, for all animals, making sure that they're having, better than just baseline health, having actual good quality of life. Okay, so more things that you can do. Monitoring. This is a really easy thing that you can do at home. I would invest in like a little scale. They're not expensive. I think they're like $20. They're like little white scales, pediatric scales, and you can weigh them once a week, once every 2 weeks. If you fall off the bandwagon and you weigh them once every 2 months, it's better than nothing. So just weigh them when you remember it. That's honestly great. Looking at their food and water intake. So that's another one. It really depends on the rabbit. If they've been doing well with these things, just kind of like eyeball it. And then if they're doing worse, then you can get more into doing exact measurements, really being nitpicky about it. And their fecal output. Once again, don't be a crazy person. Don't like count the amount of feces, but just see, ooh, that's looking like we've been having a little bit less lately. So in summary of all the things that you can do, it depends on your rabbit, depends on their condition, but there are many, many things that you can do to try to help. Okay, so that's what you can do, but what can we do? I am a vet after all. So veterinary care. So I would say the general rule for vet care is you want to be going at least once a year for an annual exam with your pet. And if your pet has a chronic disease, then you should be going probably ideally at least once every 6 months. So some things I'm going to talk about just very briefly of why I think you should be going to the vet are doing a physical exam and then 2 of our baseline, 3-ish of our baseline diagnostics, just super brief overviews of what they do of x-rays, ultrasound, and blood work. Okay, so this is an interesting statistic. So it's been said that roughly 20 to 50% of mature or senior pets are diagnosed with a new, often hidden illness or medical condition during their annual veterinary exam. And I think that it could be even more than this, honestly. But during the physical, that's the part where you bring the animal in and the vet looks at them, looks over all of their different body systems. We're able to not only see more than what you can see at home, but this is something that most of us have done. We do all day. We do it all the time. So I kind of say it's like a car mechanic, I feel like I am the uneducated car owner when I go there and they're like this and this and this and this. And I'm like, I don't even know what you're talking about. And then that's me at the vet where I'm like, I'm trying to educate you on everything that's going on with your rabbit. Even though you see them all the time, there are so many things that I've looked in like thousands of rabbit ears. You might have looked in a couple of rabbit ears, but I can draw on experience from all these different other ones that I've seen before. Another thing is even if you're able to do some parts of a physical at home, which is awesome, I'm guessing you're not able to like really get back and look into the back of their teeth and their molars. That's something that we can do that's super important with their dental health. So a physical exam, really good, thorough physical exam is very important. Another thing, make sure you're going to a rabbit savvy vet. Rabbits are not something that's taught extensively in school. It really depends on the vet school you go to. I did not learn most of this in vet school. Most of it I had to learn in practice, on externships, in different places. So make sure, sometimes it's an emergency, this is what's open, you have to go there, and that's what happens. But if you can't get established with a vet that knows what they're doing and that's passionate about rabbits. Okay, so a little bit about x-rays and ultrasound. Just very, very brief. We know what an x-ray and an ultrasound are, but x-rays generally are going to give a really good big picture. They're better for looking at orthopedic issues. So, something like anything going on in the spinal cord, if there's a fracture, if there's anything like that, that's going to be the best on an x-ray. And they're the best bird's eye view. So that is what I end up using most of the time in rabbits. I don't do tons of ultrasounds, but ultrasounds are really good when you kind of have an idea of where the problem is. Then you can look more closely at that specific organ on an ultrasound. And then baseline blood work. So, x-rays and ultrasound, not ultrasound so much. X-rays are cool in that I can show an owner an image and you're able to kind of follow along. You're able to see, oh yeah, I can see the skeleton. I can see this. When I hand you just a sheet of blood work, it's just like a bunch of numbers and a bunch of values. And it's like, okay, what is this? Who even cares? But it's so important because this can help us figure out exactly what disease, what illness is happening. So there's 2 main parts. there's a CBC and a chemistry panel. This is the same for pretty much all species. On your CBC, there's going to be red and white blood cells, platelets, and it's going to be the best at detecting inflammation and infection. And then for your chemistry, that's going to look more at specific organs. So you're going to see your kidney and liver values, proteins, metabolic values, electrolytes, and that's really good for kind of targeting more of where is this problem. Another thing about blood work is that I don't think all labs are created equal. I'm very particular. I really like Avian and Exotic ClinPath Lab. I think they do a great job. Sometimes it's a little bit slower, but I think they're really, really helpful because this is all that they do. They don't do dogs and cats, and so it really helps having a lab that has been established, trusted for a long time, that's really good at this. Okay, so figuring out what exactly the disease process is super important, but one thing that a lot of these have in common is that they need pain control. So these are a few of my favorite drugs to help with pain control. And I'll just say too, Sound of Music, great movie. Highly, I love it. We have a vet tech named Maria, and so I tell her almost every week, you need to see this movie because there's a song about you. So first of all, meloxicam. This is like my go-to. This is my favorite. It was mentioned in the emergency lecture. I'm a big fan. Some people have different opinions, but I really like this one. And I have some pictures down here of, I got a great opportunity to go to the Colorado Zoo for an externship in vet school. It was super cool. I did a lot of fun things. But one of the main vets there, he kind of had a joke of when there were animals that were, in some sort of pain, but we didn't really know exactly what it was. And he would say, oh, they have meloxicam deficiency disorder. So yes, that's what I think of with this. So it's an NSAID, non-steroidal anti-inflammatory drug. In the human world, you can think of Advil, Aleve, aspirin. And so pretty much what happens is when the body's injured, it produces enzymes called COX. Those make prostaglandins, and that triggers the pain, inflammation, and fever cascades. And so using an NSAID, you're going to block these and reduce the symptoms. Something else that's really good about this compared to steroids, not so much rabbits, but for other things, is that it's one that you can start and stop really easily. You're not going to run into big issues with that. Main caution is with kidney disease. So those prostaglandins are useful for blood dilation to the kidneys. So if an animal has kidney disease, this is something I'd be pretty hesitant to use with them. Gabapentin, this is another good pain control drug, and it helps mostly with neuropathic pain. So it doesn't really act on GABA receptors despite its name, and it's an anticonvulsant. So basically it binds to calcium channels and it reduces the release of different neurotransmitters that cause excitement and pain. And the most common side effect is sedation. So here's the problem. The sedation is kind of the thing that we run into with this drug, is that giving the dose a lot of times, then that rabbit is like, acting out of it, not themselves. People really don't like that. What I tell people is if they're having those adverse effects, something you can try is going to half the dose of this. There's going to be no harm, no risk in decreasing that dose by half. You never want to go above a dose that's recommended. But with gabapentin, if you go to half of it, you should still be safe. And then lastly, buprenorphine. This is the big guns. So this is part of the opioid class. Some other drugs that you might have heard of before are butorphanol, tramadol, hydromorphone. And so this partially activates and binds to mu-opioid receptors, and it inhibits pain transition pathways. This is the one that I'm not reaching for as often, and it's not really one that I keep animals on long term typically, but it's really good when we're having like a lot of pain and we need to control that. So some downsides of this, it's a controlled substance, so there's a bunch of other stuff that comes with that, and it can start GI stasis, so we don't like that, and it also can cause sedation. So just like a little cheat sheet of these different drugs, when I would use them and some of the things we talked about. So I like meloxicam is my go-to. Gabapentin is one that can be used in conjunction with that and can work really well. And No. Oh, it's right. I just switched it in my head. And buprenorphine is more reserved for those times when there's more intense pain and we just need it for a little bit of time. Okay, so then the sad part, when we cannot manage pain any longer, then we have to get into quality of life. And it's not something that, anyone is excited about or happy about, but it's a reality of having a senior bunny or a bunny with special needs. So I was talking with my best friend recently, who she's also a vet, and she said something of, it's really interesting and kind of sad that we have a really low bar for animals of saying that they're eating and drinking. And if you thought about that with a person, if you thought about, like, if I asked, like, how's your great grandma doing? I heard she had a health scare, and you said she's eating and drinking. That'd be kind of weird, So you want to, like, know more of, oh, well, she's going out, she's still playing Scrabble, or like, no, she's not doing so well, XYZ, whichever way it might go. But eating and drinking, like, we can do better than that for sure, right? So it's important to think of when they actually do have that quality of life. So something that I learned in vet school that it was like an intern that talked about this, 5 things that make my pet my pet. And so think about it when they're not a senior, when they're actually doing pretty good. What are the things that are unique to my rabbit that they always do? They always run up and bite my ankles. They always take my nighttime treat. Whatever it might be, those 5 things that make your rabbit yours, think about those. And when you have 0, or when you only have maybe like 1 or 2, then really think, is this really a good quality of life for them? Are they really, enjoying their time here? Are they suffering? Those sorts of things. It's a really hard question for me to answer for people. Sometimes I have really big opinions on this, and I think, yes, you definitely should. No, you definitely shouldn't. But a lot of times it's really in the middle when people come to me, and I'm like, you could go either way, but honestly, you're the one that lives with this animal. I only know medically how they're doing. You're the one that sees them all the time. So really taking into consideration, is this a good life for this animal? And that's going to be different for different animals. So in summary, make the necessary changes to keep your bunny happy and healthy. There are lots of creative things you can do, but also let go of the stuff that you can't do, because they're getting older and there's some things you can't do anything about. So just accept that part. Senior and special needs bunnies, they should have a good vet relationship. It is so much better to start it early and go to the vet even when you don't really need to. Do those annuals and have it be a checkup that you're like, dang it, I wasted $90, but everybody's healthy. Do that stuff. It really helps, because then when you're in those situations and you really need them, they're going to be there for you more, and they're going to have a better baseline history of your pet and know what's going on with them. Pain meds, they make the world go round. I think they're great in senior bunnies, because we really want to make sure that they're having a good quality of life, and for us to always keep that in mind with our senior rabbits. Thank you so much. I'm open for questions, and here's my contact.
Thank you so much.